service of reconciliation and justice. The church is in Africa at the service of reconciliation, peace and justice.
This is the Africa service of Vatican Radio.
Welcome to our half-hour daily program for Africa.
Stay tuned for our bulletin of church news, which will be followed by Panorama, and then our feature, Health and Healing. I am Johnny Baptist Tumusime. Pope Francis has told the pilgrims who came for the midweek general audience on Wednesday in the Vatican that the elderly have a special vocation to welcome the young into the world and to testify to the unity of the different generations in the unfolding of God's saving plan. The Holy Father was reflecting on the value of old age as presented in the mysterious figure of God in the book of the prophet Daniel. David Watkins reports.
At the Wednesday general audience, Pope Francis reflected on the value of old age, focusing on Daniel's prophetic dream about the Ancient of Days. The Pope said the vision, known as a theophany, highlights the connection between old age and youth. Everything about the man in the vision is full of vigor, strength, nobility, beauty, and charm, he said. Yet, noted the Pope, the man is described with hair as white as snow, like an old man, symbolizing eternal existence. Pope Francis stressed that there is no need to strip our faith of symbols when the Pope, the man is described with hair as white as snow, like an old man, symbolizing eternal existence. Pope Francis stressed that there is no need to strip our faith of symbols when trying to explain the Bible to others.
Non bisogna demitizzare tutto coi bambini.
The image of God who watches over everything with snow-white hair is not a silly symbol, he said. It is a biblical image, it is noble and even tender. God, added the Pope, is both ancient and new, since he is eternity. In the same way, humanity needs to rediscover the importance of allowing the old and the young to interact and share experience and enthusiasm. Old age, said the Holy Father, must bear witness to children that they are a blessing by embracing the mystery of our destination in life. The Pope said the elderly have a unique way of bearing witness in such a way that is credible to children.
Quando l'anziano benedice la vita,
It is irresistible when an old person blesses life as it comes their way, he said, laying aside any resentment for life as it goes away. At the same time, said Pope Francis, it is painful and even harmful to separate the ages of life and pit the old and the young against each other as if they were competing for the same resources. Pope Francis concluded his catechesis by encouraging parents to allow their children to interact with the elderly even as they near death's door, so as to pass on the wisdom of the dying. The alliance between the elderly and children will save the human family, he said.
la morte è certamente un passaggio difficile.
Death is certainly a difficult passage from life, concluded Pope Francis, but it is also precisely then that the beautiful part of life begins, since it is stripped of all deadlines. I'm Devin Watkins.
The International Congress of the World Catholic Association for Communication Signis entered its third day on Wednesday in the South Korean city of Seoul. The meeting opened on Monday, and on Tuesday the participants were addressed by the prefect of the Vatican Dicastery for Communication, Dr. Paul Ruffini. Father Paul Samasuno is there, and he filed the following report.
After reading Pope Francis's goodwill message, Dr. Paolo Ruffini gave a keynote address on the day's central theme, Hyper-Connected Yet Alone. Dr. Ruffini observed that notwithstanding great strides in digital technologies, human beings still experience profoundly the paradox of our time, which is that of division, connected yet alone. Quoting Pope Francis, Dr. Ruffini encouraged Catholic media professionals to go beyond just being connected and discover actual communication as encounter and dialogue. He further encouraged Signis members and Catholic communicators to go against the trends of the world, to go against the logic of domination, because after all, A kite can only fly when it goes against the wind. Other speakers, such as Sydney's World President Dr. Helen Osman, spoke about the need for Catholic communicators to embrace synodality and the synodal approach in their line of work. Dr. Natasha, Director of the Department for Pastoral Theology in the Vatican's Dicastery for Communication, said, "The message of the gospel is never old. The gospel continues to provide critical and relevant approaches for modern-day challenges." She called on Catholic media to help shift internet and digital discourse from dismay to hope. As expected of South Korea, the Cygnus Congress has been produced to near high-tech perfection. Various Korean Catholic bishops and top Korean government officials are gracing the conference. Some K-pop producers, K-drama actors and directors are also scheduled to address the Congress. In Seoul, South Korea, I'm Father Paul Samasumo for Vatican News.
The International Catholic Charity Aid to the Church in Need has reported that Christians in Mali, Niger, Nigeria, and Burkina Faso are experiencing religious persecution and forced to practice their faith in hiding for fear of attacks. In a report published on Monday ahead of the International Day to commemorate the victims of acts of violence based on religion, which will take place on August 22nd, the charity is calling upon the international community to pay attention to the intolerance and discrimination against religious groups, especially Christians in Africa. For the last 10 years, Christians in Mali, Burkina Faso, Nigeria, and Niger have suffered attacks from Islamic militants. Religious leaders in Kenya have called for peace following the eruption of tension after the country's electoral commission announced William Ruto as winner of the presidential election held on August 9th. The results of the election were rejected by Ruto's main challenger, Raila Odinga, who said he would challenge the election outcome in court. The religious leaders invited whoever was dissatisfied with the results to seek the legal process as prescribed by the Constitution. Benedict Mayaki has the details.
Kenya's religious leaders are calling for peace and calm amid tensions in the wake of the announcement of the results of the recently concluded presidential elections, which took place on the 9th of August. On Monday, the 15th of August, the chairman of the country's Independent Electoral and Boundaries Commission, Wafula Chebukati, declared Deputy President William Ruto as the president of Kenya in a tight presidential race against his main challenger, Raila Odinga. Ruto received 50.49% of the vote, while Odinga received 48.85% according to the IEBC. Chaos ensued just before the declaration of the results amid scuffles and allegations of vote rigging by Mr. Odinga's camp. 4 of the 7 members of the Electoral Commission distanced themselves from the results that were to be announced, saying that the way the votes were handled was opaque. In a press conference after the announcement of the president-elect, religious leaders prayed for peace in Kenya. Archbishop Anthony Muheria of Nyeri invited all religious leaders and all believers to pray and to place the country in the hands of God, encouraging them to give each other the great gift of peace. The Archbishop also addressed the 2 main candidates for the country's #1 position, invoking peace on the president-elect and urging him to give peace to everyone and to his contenders. The Archbishop also offered peace to Mr. Odinga, asking him to receive that peace in his heart and to give it back to the nation. I'm Father Benedict Mayaki.
You are tuned to the English Africa service of Vatican Radio.
African News Panorama.
Kenya's President-elect William Ruto said public expectations were huge and there was no time to waste. His statement followed a meeting held at his official residence on Wednesday with elected officials from his alliance. Although his opponent Raila Odinga has said he would challenge the results of the August 9th presidential election, Ruto said he was forging ahead with creating an administration. He said no part of the country would be excluded regardless of political or ethnic affiliations. Deputy President William Ruto was on Monday declared the winner with 50.5% of the vote by Kenya's Election Commission chairman. But rival candidate and veteran opposition leader Raila Odinga on Tuesday rejected the results as now unvoid and a democratic setback. He has said that he will contest the decision in court, calling it a travesty. In response, without directly addressing Odinga's plan to challenge his victory, President-elect Ruto says they will engage if there will be court processes, adding that they have to adhere to the rule of law. Meantime, the European Union has commended Kenyans for peaceful elections and urged parties to resolve the remaining concerns through legal means. In a statement, the European Union said it had taken note of the results by the Electoral Commission of Kenya, declaring William Ruto as winner of the election and the decision to appeal by Raila Odinga. European Union High Representative Joseph Borrell said that all political and societal leaders must avoid any violence and call for calm. He said it is time for political leadership and responsibility from all those linked to the electoral processes. Borrell also congratulated President-elect Ruto. Ghana is investigating a TikTok user after posting a video on the app allegedly threatening to kill patients. The TikToker is said to be a nursing student in the country. In the video, the female nurse appeared in a nursing school uniform and claimed she will kill any client who seeks her service as a nurse because she was forced to pursue nursing against her will. Ghana's Nursing and Midwifery Council said in a statement. It said further that investigations have commenced earnestly to identify the said student and apply the necessary sanctions. The Nursing Council also said that the student made the remarks out of ignorance about the nursing profession and urged the public to treat the video with the contempt it deserves. It also warned nursing students against using uniforms for unapproved activities. Thousands of ethnic Tigrayans who have been detained in camps in northeast Ethiopia since December are being transported back to their homes. The United Nations is facilitating their return back to their homes near the border between the Afar and Tigray regions. The United Nations said the operation would continue for a week. The government in Addis Ababa said the Tigrayans had been taken to the camps for their own safety as the civil war spread, but the state-run Ethiopian Human Rights Commission said they had been targeted because of their ethnicity and described the detention of around 9,000 Tigrayans as illegal. Their return comes as hopes of peace talks to try to end the civil war appear imminent. The heads of states from the Southern African Regional Bloc SADC are meeting in the Democratic Republic of Congo for talks on economic growth and integration. The leaders are expected to discuss how to promote industrialization through the transformation of agriculture, the development of mineral resources, and the development of value chains at the regional level. Another aim of the summit is the handover of the bloc leadership to the Congolese President Felix Tshisekedi by the current head of the bloc, Malawi President Lazarus Chakwera. The Democratic Republic of Congo also intends to seek the assistance of the bloc to restore peace and security in its territory. You are tuned to the Daily Africa service of Vatican Radio.
And now, our feature, Health and Healing. Medical doctors have continuously warned against flat conclusions regarding COVID-19 because there is still much to know about the coronavirus which causes the disease. This is because the virus is evolving and therefore remains unpredictable. Dr. Abdul Mahamoud, who is an official of the World Health Organization, the WHO, he explains why the virus causes multiple complications in the body.
When people talk about COVID, you think it's a respiratory disease. Unfortunately, COVID is a systemic disease. A clinician can understand. For the public, it looks like because you just presented with a sneezing or a cough, it affected there. Unfortunately, it affects almost every part. Has been documented, the complication, whether it is the virus itself or our immune system start misfiring, we really don't know. There's a lot of research going on. The risk and the complication from COVID, when we see it as not as a respiratory pathogen, of course, that's the way of entry, but it's affecting every part of your body. The virus is so complicated. That's why we say the only way you can do, get vaccinated and continue preventing yourself with those public health measures.
Dr. Maria Van Kerkhove is the head of the World Health Organization's department for coordinating at the international level the fight against COVID-19. She told reporters in Geneva last week that ending the COVID-19 emergency requires the cooperation of everybody.
What we have to look at is, people who are infected and have COVID-19 now, people who are suffering from longer-term effects that we are just learning about. Those long-term effects could be a few weeks, they could be a few months, they could be a few years. We don't know what that is yet. And so as WHO, with governments, we need to plan for the longer term. So it's not just now. We're thinking into 2022 and how we end the emergency of this pandemic, but we have to plan, and we are planning for the longer term and how we deal with the effects of this. And we have to think not just COVID, but mental health effects and the effects for people who have not received other vaccines for vaccine preventable diseases, people who didn't get the care that they need for cancer, for other treatments. So this is obviously quite a complex situation that the world is in, that countries are in. But this is all the more reason why we need to end this emergency of COVID-19. And we have to end it as quickly as possible. It's in our hands. And we need everyone out there. Some people may think, what can I do to help? You can get vaccinated if you have access to the vaccine. Take measures to prevent you from getting infected, because it's not just even about you, and we want to protect you, but we also want you to protect your family. We also want you to alleviate pressure on the health systems, because if you get infected and you need clinical care, you take up that bed as you deserve to take up that bed, but you take that bed from somebody else who may need it for another reason. So it has a domino effect. And so this is why it's so critical that we really work to end this emergency this year.
Last week, some media houses in Europe published information quoting scientists that the COVID-19 caused by the Omicron variant is similar to a cold, and therefore in future it is likely that COVID-19 will be like a cold. The World Health Organization has warned against taking such views seriously. Dr. Van Kerkhove again.
SARS-CoV-2 is a coronavirus, and the common cold viruses are coronaviruses. So there are people that are out there that think that this virus may become more like the common cold in years from now. That may very well be true, but we're not in that situation yet. SARS-CoV-2, Omicron, the latest variant of concern, is not the common cold. It still causes severe disease in many individuals. And with the huge number of cases that we've seen, we still see too large of a proportion of people needing hospitalization and dying from this. So it is not the common cold. Countries are in very different situations. They are looking at the population level immunity that they have from infection and from vaccination. They're looking at the capacities that they have to respond, to detect, to impose measures, to lift measures. They are looking at adjustment, and they're looking at different ways in which they can apply tools. We are recommending that countries be cautious and to continue to use measures. I'm not meaning lockdown where you shut down society, where you lock people away. That is not what we are talking about. But to use tools to continue to drive transmission down. Countries have to take those decisions. We issue guidance, but the policies that countries take are up to the countries themselves. We are working with them to ensure that they protect their own people. But again, COVID-19 is a global problem. It's a pandemic and it needs a global solution. So what we look at is, on the whole, what tools need to be applied. And we're working with countries how they best implement them. But we are asking countries to continue to be cautious and individuals to continue to be cautious as we go forward. Again, it will not be forever. You will not need to wear a mask forever. We will not need to physically distance forever. But for now, it's really important that we be careful.
Children are a category that is still complicated to study when it comes to COVID-19. Many get infected, but majority are able to recover without much difficulty.
We know that children can be infected with SARS-CoV-2 virus, whatever variant is circulating, and this is certainly also the case of Omicron as well. What we tend to see when we see a new variant of concern circulating, we tend to see trends in different groups based on social mixing patterns. We saw this with Alpha, we saw it with Beta, we saw it with Gamma, we saw it with Delta, and we are seeing it with Omicron. So the groups that are out and mixing will have higher rates of infection just for the sheer fact that they're in contact with each other. We do see this among school-aged children because children are back at school. Children overall, and including with Omicron, tend to have less severe disease compared to adults. That's certainly the case. More often they have asymptomatic infection, meaning that they don't have any symptoms at all. Those trends still continue. But we do see children requiring hospitalizations. And there have been some instances where we've seen hospitalizations increase in pediatric populations, under 5. As we've seen Omicron circulate, we are also seeing other respiratory pathogens circulate. So it complicates the picture. We see RSV that is circulating, which tends to be a respiratory virus that infects young children or younger children. And influenza is back. So through our GISRIS, through our global influenza surveillance and response system, we are tracking influenza as we have been for decades. And in 2020, 2021, influenza circulation was minimal, if not wiped out. But we are now starting to see increasing trends again. So this will complicate pictures. And speaking as a mom of 2 young boys who always seem to have something with a runny nose or, something, not COVID-19 because we have access to tests here. We're very fortunate to that. Maybe not RSV, maybe something else. So it does complicate the picture in terms of what is circulating. So I mentioned that particularly because of kids. Because kids tend to mix. It's very difficult for children to wear masks and keep them on, although we are seeing that they can. I'm not saying that they can't. To keep their physical distance, is also quite challenging. But we've seen many, many schools around the world, and I do want to emphasize how important it is for children to be in school, for their education, for their safety, for their well-being. And many around the world have shown how can open schools and keep schools open by taking measures of having good surveillance in schools, having good environmental controls of disinfection, of improving ventilation, wearing masks, making sure that the staff are vaccinated, and as well, keeping transmission down in the communities. So there's a lot that we are learning. On long COVID, we do know that children can get long COVID. Again, we don't have a good estimate of what proportion of children will have these longer term effects. We know that it is possible. That's not to scare parents out there, but again, it's just to re-emphasize that we need to do what we can to reduce the spread. Abdi?
In some countries, vaccination is recommended. So if it's recommended, please get vaccine because the complication of COVID far much outweighed by vaccine that you get. So vaccines in those countries as recommended, please vaccinate children. Children do get COVID. Unfortunately, sadly, some of them tragically have died. The death of one child is sad for everybody, for the whole community. So where those countries recommended, these are safe and effective. They have been studied and children have been receiving all the routine immunization. So as I say, please get vaccinated to protect your loved ones, however young they are. The lottery of how the body immune system is going to react, nobody can tell. We have seen almost 800 children, I think the US, who died sadly. So children can get infected, they can get hospitalized, can get severe like any one of us. Luckily, the vast majority of them don't end up there. But that 0.1 in a big population is a big number. So please vaccinate your children when those countries recommended. For us, we have a criteria as WHO, 194 countries. We want to vaccinate the 3.1 billion people, the adults who are the highest risk, the healthcare workers. But in some countries, the world is not in the same situation. So if you're in a country where vaccination for children is offered, please vaccinate your kids.
Those were Dr. Abdi Mahamudu, the head of the Incident Management Department at the World Health Organization, and Dr. Maria Van Kerkhove, the head of the World Health Organization's Department, for coordinating at the international level the fight against COVID-19. As you have heard, Dr. Van Kerkhove and Dr. Abdi have mentioned the importance of immunity in the fight against COVID-19 when it comes into contact with a microbe such as the one which causes COVID-19. Dr. Soumya Swaminathan is the chief scientist of the World Health Organization. She explains.
Our immune system is actually amazing. It's versatile, but it's also complex. And when the body is exposed to a new virus like the SARS-CoV-2 virus, which it's never seen before, the immune system does get activated, and there are many things which start happening. The first and the most rapid response is the production of antibodies. And this is also accompanied by messages that are being sent to other parts of the immune system so that the T cells or the cell-mediated immune response is also activated. And ultimately what happens is that if the body's immune response is strong, it's able to overcome the virus and eliminate the infection, but also it develops a memory response so that the next time the body sees the same virus, it's able to respond much more quickly because the memory cells, both memory B cells and T cells in the body, are able to recognize and respond. So we all talk about antibodies all the time. It's one part of the immune system, but it's a much larger and much more complex system which keeps us healthy and, gives us the ability to respond to a lot of infections.
One of the elements that helps our bodies to develop immunity against infections are vaccines. Dr. Swaminathan again.
The way vaccines work, and they're an amazing innovation of the 20th century, is by mimicking the organism, the virus or the bacteria. And so the spike protein of the SARS-CoV-2 virus is taken and made into a vaccine. Of course, we know there are different types of vaccines, mRNA, the virus vector vaccines, inactivated, but they all do the same thing, and that's present in a safe way the antigen of the SARS-CoV-2 to the body. And so the immune response that's generated is very similar to the immune response to a natural infection. But of course, the vaccines are a safer way of stimulating the immune system.
That was Dr. Soumya Swaminathan, the Chief Scientist of the World Health Organization. And that was Health and Healing for this week. You have been listening to the English Africa service of Vatican Radio, and I am Johnny Baptist Musime. In our